Hi viewers, let's learn about migraine headache and tension type headache. We know in the busy OPD at times we have doubt whether it is migraine headache or tension type headache. So there are certain clues which is given in the International Classification of Headache Disorder Society that how to differentiate between migraine headache from tension type headache. Now let's see. So they have given a criteria we all know A, B, C, D, E, that is A, B, C, D, 5 should be there to fulfill the criteria for diagnosing of migraine headache. So just how to remember this. A is for attacks, B is for basic requirement, that is duration of headache, and C is the certain characteristic features, that is out of 4, 2 should be there, and D is during headache. Patient should have one of the two, and E is exclusion, that is other causes. Now let's see what happens in migraine headache. So attack. Migraine headache, to label it as migraine headache, a person should have at least 5 attacks should be there in his lifetime. While in case of tension type headache, the person should have at least 10 attacks should be there. Now coming to the B, that is basic requirement, the duration of the migraine headache. So in migraine headache lasts for 4 hours to 72 hours, while in tension type headache it lasts for 30 minutes to 7 days. Now coming to the C, that is characteristic of headache. So 2 out of 4 of the below characteristics should be there in case of migraine headache. That is migraine headache is unilateral headache, while in tension type headache it is bilateral headache. It can be occipitonuchal or bilateral frontal headaches can be there. And next feature is migraine headache is throbbing headache, while in tension type headache it is non-throbbing or non-pulsatile headache. Now the severity of headache in migraine headache it is moderate to severe intensity, while in tension type headache it is mild to moderate severity of the headache intensity. Now next is in migraine headache the physical activity will worsen the headache, like cycling, walking, daily routine will worsen the headache, but it doesn't worsen in case of tension type headache. So this is very important feature. So we can ask whether daily activity worsen the headache. If it is worsen, it is migraine headache. If it doesn't worsen, it is tension type headache. That finishes the characteristic of C criteria. So out of this 4, patient need to require 2 out of 4 patient need to fulfill either in migraine headache or tension type headache. Now comes the D. D is the during headache. So during headache, the patient should have 1 feature should be there out of 2 in both the migraine headache or tension type headache. So let's see what is that. In case of migraine headache, the patient should have, along with the headache, during headache, patient should have associated nausea and or vomiting. So patient can have either nausea or patient can have or vomiting or both the combination too. But patient should have, if we are taking photophobia as a criteria, patient should have both photophobia and phonophobia in case of migraine headache. So again, once again, photophobia and phonophobia, or patient should have nausea and or vomiting. Each word is important. What about in tension type headache? Tension type headache, two features during the headache. Patient should not have any nausea or vomiting. That is the one feature. Second is the patient should have no more than one symptom. That is patient should not have both photophobia and phonophobia. Patient should have only one. Photophobia or phonophobia is possible in case of tension type headache. So that's complete the major differentiating between the two. And E is exclusion, means it is not defined by any other causes like a tumor, infection. So everything headache fits into this. That is the E criteria. So this is how we differentiate migraine headache from tension type headache. Hope you have understand that and you got my point how to differentiate migraine headache from tension type headache. Thank you.